A big day for healthcare in America as a vote just took place in the House of Representatives, passing the Republican healthcare plan, but also big news on the Affordable Care Act and the 24 million people who are enrolled in Obamacare, as today 4 House Republicans came forward and said they would support an extension, a 3-year extension. And here's what that could mean. A new analysis, if Obamacare doesn't go forward. A new analysis from the Center on Budget and Policy Priorities breaks down the potential impact by congressional district. It shows that a 45-year-old making $32,000 in these 2 districts in California could see their annual premium spike by almost $1,500. You see it there, from about $700 to more than $2,100. And this is a story that we would see all across the country if Congress doesn't extend the Obamacare tax credits. The 2 congressmen who represent those 2 districts, Republican Kevin Kiley, right side of your screen, Democrat Jimmy Panetta with us as well. They are in a coalition of 35 House members working to come up with a bipartisan health care solution. Congressman, it's been a busy day. You just came from the House to the cameras. I appreciate the hustle. And I got to say, a Democrat and a Republican standing here together speaking on the issue shows the seriousness. I appreciate you both. Congressman Panetta, let me start with you. What are you guys trying to do as Democrats and Republicans here and the way forward?
First and foremost, it's making sure the tax credits for the ACA get extended, because as you showed in that brief graphic, this is going to lead to a crisis. I mean, you get a family of 4 making $128,000 a year. Their premiums are going to go up $3,000 a month. That's $36,000 a year. A family of 4 at $60,000, their premiums are going to go up $300 a month. That's why we wanted to make sure that we extend those tax credits. That's why I give credit not just to Kevin Kiley, but I give credit to the other Republicans who signed on to the discharge petition today that demands a vote on extending the tax credits for 3 years. First and foremost, we had to do that.
Congressman Kiley, when that vote comes forward on the 3-year extension, could happen this year, most likely happening early next year. What are you planning to do, and how many other Republicans might join along?
Yeah, that's a good question. I'm undecided on it right now, and the reason for that is not because I don't think we should extend the subsidies. Of course, I think we ought to extend the subsidies. I've offered a bill to do just that. I've signed 2 discharge petitions on other compromise measures. I am very reluctant to get behind this extension, though, that's 3 years without any reforms. And the reason for that is I don't think it's ever going to become law. The Senate has already said we're not going to do that. They voted down that precise proposal. So, Jimmy might not agree with me fully on this particular point. I'm sure he shares my frustration with Speaker Johnson for not bringing a bill to extend the subsidies to the floor. I'm also frustrated with the minority leader, Hakeem Jeffries, for not endorsing a compromise measure that could actually become law.
And it's fascinating because is governing.
Yeah, go for it, Congressman.
It's governing by discharge. Yeah, no, the frustration is based on the fact that we're governing by discharge petition and not governing by leadership. And that's a real issue with both of us.
It's fascinating listening to you both, because you both are working together to try to come to a solution. But what I just heard was you disagreeing on the solution. And I just think the average person at home watching us on NewsNation or listening to us on SiriusXM might say, I see them. It's commendable, but can there really be a solution if guys like this who want to work together still don't have the final compromise?
Well, no, we actually did both sign on to the same bill. For example, the Gottheimer-Kiggins bill, we've both signed the discharge petition for that. We've both, as you mentioned, signed on to the framework of 35 bipartisan lawmakers. We actually agree on the fundamental aspects of this, which is why I'm frustrated with the leadership of both parties who have kind of staked out positions that are much more extreme on each side, rather than coming together on the proposals that actually have demonstrated bipartisan support and that I think could pass the House, pass the Senate, and become law.
Yeah.
Congressman Panetta,
Kevin brings up a good point.
There's a delay. Go for it.
He was about to say I brought up a good point, so we definitely want to hear that.
No, I'll give it to you.
He brings up a good point. It brings up a good point in that there's a short-term fix, and that's extending the tax credits for the ACA. But there's got to be a long-term fix. There's got to be serious analysis in a bipartisan fashion that looks at why these costs are rising so much in our health care, how we can fix Medicare, how we can ensure that there's Medicaid to our constituents.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.